Good afternoon. I'm Jill. Nice to meet you.
Hi, I'm India. Nice to meet you too.
We'll just go ahead and get started here. Tell me what interests you in this position.
Well, I've been working in healthcare for about 5 years now, and I just really want to try something different, something more administrative, more paperwork, just more of the managerial side of things.
Okay.
So,
Um, Tell me how your education and experience would be used in this position.
well, I've done a lot of volunteer hours, actually answering phone calls and filing paperwork, just volunteer experience, and it's helped me a lot understand more of the paperwork side. And then with the clinical experience, I think it will be a lot more. It will be better to understand patients, patient care, and just you can understand both. I'm coming from a clinical side and the managerial, where I run into the problem of managers and just assistants working who have never been in the clinical setting. And so they don't have both that knowledge to go hand in hand to even offer empathy um, to staff.
Okay, I agree. What part of this role might be challenging for you?
Honestly, the sitting. I am a go person. Um, it's a different. It'll be a different environment for sure. Um, I'm always surrounded by different people every day, all the time, and so seeing the same faces every day, the sit down, the calmness, something that I more than likely need. But I think that'll be the biggest challenge is to sit down and just be.
So tell me some strengths and weaknesses of yours.
Let's see. I think my weakness could be a little bit of my empathy, which it can be a strength and a weakness. The strength of it just being like, being able to empathize with people, but then just sometimes the caring of too much, you just feel that emotional attachment, which in the medical field, they're like, you need to try to separate so you don't get too emotionally involved. But it's so hard. You see and hear so many different stories and people's struggles, and you break down for them. And I don't want to be in that predicament of trying to figure out their life for them, because that's me.
So how would you describe yourself to someone who does not know you?
Oh my goodness. um I think I'm a pretty nice individual. um Caring, crybaby. I cry everything. TV show, somebody dies, I'm crying. Yeah, so just a empathizer, really, a soft heart. I can yeah, I don't have a mean soul. Yeah.
How would your peers describe you?
Well, they say I'm too nice. Again, working as a tech, they're like, don't let these patients walk all over you. I'm like, no, no, they're fine. I'll do it. I don't mind helping people. I literally love helping people. And they're just like, no, Indy, you're too nice. You're overworking. You need to sit down. It's a 12-hour shift. Go sit down. It's okay. So I'll get it done.
Um, Give me an example where you showed leadership and initiative.
Okay. Let's see. Actually, the other day, patient came in, just she wasn't able to do for herself, and the caregiver just didn't seem like he was willing to help her at the
Mhm.
time, and everybody was just kind of over it, just because again the caregiver had come in there, and it's just like, well, you're the caregiver, do it, but you're in the hospital, so that's our job to help. And she was not my patient, but she had kept diapers on, which we don't like diapers in the hospital because it makes it a lot harder to change a patient. But she basically was having a bunch of bowel movements, and nobody would get up to clean her. And I actually was at the end of my shift, and I was just like, it's not that it's this is our job. Like, I don't mind. So I got up and I was just like, give me the gown, let's go in there and handle it. And then eventually somebody came in there and helped me because they saw that I had entered the room. And she was obviously out of it. She could not do anything for herself, so I took that initiative to just help clean her up, because I wouldn't want to lay like that, especially not knowing. And who's to say she doesn't know? She might not be able to verbalize it, but um yeah, so we cleaned her up, and after that she was nice and clean, and he said thank you so much, because he was older too. And yes, he's a caregiver, but who's to say he can actually give adequate care that we can, that we're trained for?
Exactly.
Um, so yeah.
What are your professional goals?
Professional goals, my professional goal, end game is to own my own practice. And what, I don't exactly know yet. Um, I just want to be my own boss. I love working, and I've worked under people my whole life. I'm just like, I just feel like being my own boss, setting the rules in a way that I feel like I've learned different ways that work and don't work, and just to implement it to create that own practice and have people come work for me in a nice environment. So that's end goal. Don't know when, what, but yeah.
All right. If you were hired, what ideas or talents could you contribute to this position or company?
Okay. Organization skills. Actually, this is the Prisma Health, and since I work for you guys, um, I feel like it can be a little bit more organized. It can be a it can be a little bit more organized. Changing where we're going in the mornings and things like that. Uh, Different floors, last minute calls. There is a way and a better way to do it. A week's out, the day before, it's not good, especially with us being travelers. Um, so yeah, a lot more different organized. And then again, because I work for you guys, I have seen it and I'm firsthand experiencing what could be better. And so I do believe the organization.
All right. What questions do you have for me about this position or organization?
Um, how is the work environment? Is it, a big kind of group, small? Um, are we friendly?
Well, it's a very big group. It's a big organization. It's a big hospital here in Columbia. It's a very big dynamic. So a lot of big personalities.
Oh goodness.
And it's any kind of hospital you're going to go into, you're going to have that. But you've worked in a hospital, so you know, and I feel like you have the personality type and skills to navigate through healthcare. So I feel like you would do just fine in this position. So
Well, thank you.
you're welcome. Is there anything else you'd like to know? Or is that all?
I believe that's all.
All right. Well, thank you so much for applying, and we'll reach out to you shortly.
Yes, thank you for having me. Have a wonderful day.
Thank you. You too.
Bye.